Okay, everybody. Well, for the sake of time, we are going to get started. And like I said, thank you for bearing with us during some tech issues. It happens. But regardless, let's get going. So hello, everyone, and thank you so much for joining us for tonight's program, Managing Tics with Medication, What You Need to Know. My name is Alexandra Walsh, and I am the Manager of Programs here at the TAA. I am joined by my colleague Chantel Campbell, Manager of Medical and Scientific Affairs, who has graciously agreed to assist me with the moderating and also the Q&A portion of tonight's program. Participants will have the ability to engage in a Q&A discussion with our presenter at the end of the presentation. So please feel free to place your questions in the Q&A box throughout the presentation. We also ask that you please take the time to fill out a brief survey at the end of this program. The QR code will be displayed on the screen briefly during the beginning of the Q&A portion of tonight's program, and the link to the survey will also be placed in the chat in case you are joining us from your phone tonight. Your responses not only provide us with valuable feedback on our adult programming, but also provide us with the data that allows us to host more programming for our adult constituents in the future. So we thank you for taking the time to fill out that survey. And I will turn it over to Chantal.
Hi, everyone. So tonight's program will be presented by Dr. Jacqueline Martindale. Dr. Martindale is a section head and medical director of pediatric neurology and the founder and director of the Tourette Association of America Center of Excellence at Wake Forest University School of Medicine. She is a physician scientist with a clinical research focusing on Tourette syndrome. She has leadership positions and collaborative research efforts with the Tourette Association of America, International Parkinson and Movement Disorder Society, Tic and Tourette Study Group, and Regional Camp for Youth with Tics Disorders. With that being said, I'm going to go ahead and turn it over to Dr. Martindale to begin tonight's presentation.
Thank you for the introduction. Like she said, my name is Jackie Martindale, and I am a pediatric neurologist, but I will talk about medications that are used in both the pediatric and adult population. I will touch briefly on behavioral therapies and some emerging therapies as well as clinical trials, but the focus of this talk will mainly be on the main medications that we use in the treatment of Tourette syndrome. So I did have research funding until recently from the Tourette Association of America. So I just have to state that I'm also on the medical advisory board. But this talk is something that I have given in a number of capacities, and that doesn't impact my what I'm going to talk about today. So I know a lot of you are here because you or somebody that you know has tic disorders or Tourette syndrome, but I just wanted to take a real quick step back and just briefly talk about tics and what they are, and then we can jump right into the treatments. And so, tics themselves are movements or sounds that tend to come and go and change over time. Not only can they change in the type of tics that you have, but they can also change in the intensity or the location. And they follow this relapsing and remitting pattern where you see something for a little bit and then it goes away, and then you see something else for a little bit and it goes away. And that's very common. And a lot of people before they have the tics will have a sensation, usually in the body part of the tic, that builds up when they are trying to hold it in. And the most common example you will hear is like an itch that you can't scratch. And the longer you try not to scratch it, the more that sensation kind of builds up until you eventually just have to do it. And most people with tics can identify that feeling, although the younger the person is, the harder it is for them to vocalize what that might feel like. And a lot of people with tics can hold them in temporarily. They can be suggestible, meaning a cough from a cold might become a tic, but they are very much involuntary. And then something just to be mindful of, although less commonly known, is that they can happen during sleep. The other things I like to say is tics tend to progress from they often will start on the top of the head and then they kind of move their way down, and they often progress from more simple tics to more complex tics over time. And we'll talk a little bit about that on the next slide, or two slides for now, I guess. And so they often start in early school age, and they're more common in males than females, although they do happen in both genders. And for a lot of people, tics will peak around like pre-puberty, between that 8 to 12 range. And for some individuals, they will outgrow their tics, but there are individuals that continue to have tics lifelong. They can either be more mild than they were during childhood, or they can be moderate to severe tics. And so just to give you an idea of how common tics are in the general population, it's thought both Tourette syndrome and persistent tic disorders impact about 1.4 million people in the United States. And many of you already know this, but there are motor tics that you will hear about, and these are movements. They can either be simple, such as an eye blink or a head jerk, or they can be complex, where they seem a little bit slower and more purposeful, like tapping or touching, or copropraxia, which are the obscene gestures, or echopraxia, which is repeating others' gestures. And then you'll hear about vocal or phonic tics. A lot of us will use the terminology vocal because they tend to come from the vocal cords. And so the terminology of phonic tics is thought to be a little bit more outdated, but you will hear people use both. And those also can be simple, like sniffing or throat clearing, which are sometimes attributed to allergies, or more complex vocal tics like words or phrases, including the repeating of others or your own. And then some of the other things that will impact treatment that we'll talk about is that a lot of people with Tourette syndrome will also have at least one other co-occurring condition. ADHD and obsessive compulsive disorder, or OCD, are the most common. But there are a lot of other co-occurring conditions that you can have. And I know you've all seen the iceberg picture, which I do believe I have in this presentation. But the most important thing to know I don't know if you can see my pointer, but the most important thing to know is that a lot of these will start around the same age, but some of the other co-occurring conditions tend to linger longer, and you can see them more towards the teen and adult period. So thinking just about how us as doctors, and how the DSM-5, which is the criteria for how we diagnose these disorders, what's in the diagnosis. And so, as you may or may not know, Tourette syndrome or disorder is when you've had both multiple motor and vocal tics for over a year. They don't necessarily have to be present at the same time, but they've had to start during childhood and not attributed to another cause. When you don't have both motor and vocal tics, you're considered to have persistent tic disorder. And then if you've had them for less than a year, it's called provisional tic disorder. And the terminology changes. So even, a handful of years ago, these were called other things like chronic tic disorder or transient tic disorder. And these are important in how you get your diagnosis and how you can identify or accept that. But in terms of how we treat all of these disorders, what really matters is whether they're bothering the individual or whether they're getting in the way. And those are some of the things that we'll be talking about. So as I mentioned, I did include the iceberg picture. So, the tics are often what bring people to a physician or a clinician, depending on who you're seeing. But just like I already mentioned, a lot of people with tic disorders have these other co-occurring conditions, and they're really important to consider because sometimes they're actually more bothersome than the tics themselves. And so when we're thinking about treatment, our goal is to focus on whatever is the most bothersome. The other thing to consider is when to treat. And so some of this is going to be shared decision making with your provider. But the things that I like to think about is what is the most problematic. So often I will ask about the tics, I ask about anxiety or ADHD or OCD. And really what I want to know is what is getting in the way the most on a day-to-day basis. And that's where we start with our treatment, or that's where we focus our treatment. Now, sometimes there's multiple things that are getting in the way. And so we really have to take kind of a stepwise approach to get everything in a good balance. So that way it's not impacting you in your day-to-day life. But starting treatment, really try to focus on what is the most bothersome. And then most importantly, tics themselves can be bothersome to those around the individual. But when I'm considering treatment, what I want to know is whether they're bothering the individual themselves. Because a lot of people, even though they have tics, they may not notice all the time that they're doing it. And especially in younger kids, they're less bothered than other individuals. And so it's really important to take their input into consideration when you're deciding whether to treat or not. The other aspects that I consider is whether it's getting in the way of the individual's life, whether that is school, whether that is work, whether that is social impact. And those are all really important things to consider. And then if the tics are causing pain or discomfort. So sometimes those repetitive movements, like a repetitive neck tic, might be really uncomfortable and causing pain. And those are things that we want to try to minimize. So that way we're not having that impact of the tics themselves. And so there are guidelines out there from the American Academy of Neurology. It seems like they just came out yesterday, but they're 6 years old at this point, which is kind of crazy. But the main way that we approach tic disorders is first by psychoeducation, which means talking about what the tic disorders are, what you should expect, and all the different factors that can impact tics. Behavioral therapy is the first line recommendation, and we'll touch upon that briefly, and then we can talk about medication, and that's generally the stepwise approach. Now, when we think about behavioral therapy, and I know the focus of this talk is mainly on medications, but there were a couple of people that asked about it in the registration. So I just wanted to make sure to talk mainly about cognitive behavioral intervention for tics, or CBIT for short. There are other therapies out there, but CBIT is the one that is the gold standard for treatment in tic disorders. And is what most people will recommend if somebody's interested in doing a behavioral therapy. Now, what that entails is trying to really simplify what CBIT entails is that we try in CBIT, they try to teach you to become more aware of the tics and urge. And so that might seem a little bit different about what when we talk about, just ignore the tics as much as possible, don't pay attention or draw extra attention to it. But in CBIT, they actually try to help you become more aware of that tic and the urge, particularly if it's bothersome. And then when you can become more aware and recognize that urge, you learn to develop a competing response, something that is essentially opposite of the tic that you're trying to change or to suppress, to make it less bothersome, less noticeable. And the idea of this is to help make changes in the day-to-day life that will help reduce the tics. Now, as with medicine, CBIT doesn't take the tics away completely, but the goal again is to make them less bothersome and less interfering. CBIT itself is really helpful. And has been shown to be really effective both in the short term, meaning the immediate period, and the long term. But there's a couple things that you need to consider for it to really help. One, you have to be old enough to do it. And so usually the earliest I'll recommend it is about 9 to 10 years old. And it's just developmentally the ability to be able to participate with the therapist and learn some of these things. And I mentioned earlier on that, individuals will recognize that sensation before the tics, but the younger they are, the harder it is. And so it's thought that by the age of 9 to 10, most people can recognize that urge, which is where that age range comes. Sorry, muted and unmuted. And then there are some younger versions of CBIT called CBIT Junior that have been done in studies, but it's not as readily available. And so these were looking at adapting CBIT for usually about the 5 to 10 range. But the other most important thing is that you have to want to do it. For any therapy to be helpful, the person that's doing the therapy has to want to do it. No, sorry. But some of the challenges with CBIT is that there's not a lot of people that do it. And so there is a specific training that's done to be able to be certified and provide this type of therapy. And so there's not a ton of people in the United States that offer CBIT, but the Tourette Association has a list of CBIT providers, and they're actively working on trying to expand the number of people that are trained to do it. There are some people that do offer telehealth options. I will add that some of the other challenges that I hear from patients and that I know from the research side is that sometimes the people that provide this therapy don't accept insurances. And so sometimes there are some financial barriers to that as well. There is an online version of CBIT called tichelper.com, which was developed by the person that created CBIT. But this is more of a self-paced module. There are some fees associated with it. Don't quote me on the specific fee, but the last time I checked, it was about $160 to do the 8-week session, the 8-week modules. And this requires somebody who's motivated and interested to do it on their own rather than having that one-on-one therapy session with a trained provider. So when you try CBIT or other therapies or therapies not available, or you're interested in medication, some of the general things that I think about and I try to tell my patients about is that for all medications, it's generally a start low, go slow approach. And because the tics tend to come and go and change over time, really when I'm trying medication or where I'm adjusting the dose, I try to give it a long enough period to really know if it's helping. And so usually about 8 to 12 weeks, which I know really seems like a long time, but it's hard to know sometimes, was it the tics just coming and going? Was it the medicine? And so we really try to give it enough time so we can see that kind of path that your tics are taking. The other thing is sometimes we're not seeing the right benefit because we haven't gotten to a good enough dose. So we do tend to start low on doses of medication and work our way up as needed. But the goal is to have you on the lowest dose of medicine and that helps, that doesn't cause any side effects. And so there is sometimes where we have to gradually increase the dose to reach that dose that may have a better impact for you. One of the other things we'll talk about is also to make sure you're treating the right thing. And so making sure that even though the tics are there, if something else is more bothersome or interfering, you may have more benefit focusing your treatment on that than the tics themselves, or vice versa. And so just having those open communication with your physician or your clinician to be able to talk about what is getting in the way the most on a day-to-day basis, and really having a good game plan of how you're going to be approaching that. And then lastly is having appropriate expectations. And so like I mentioned, unfortunately, no medication or therapy is going to take the tics away completely. The goal of medicines is to make them less bothersome, less interfering. And whether that's pain, social impact, or getting in the way at school or work, having those discussions with your doctor so you know kind of what you're aiming for and how to titrate or change the medication as necessary. So I don't expect you to like jot all this down. We'll go through some of the medications, but in general, this tends to be how I think of medications. And this was in a review article in one of the big neurology journals. So we'll go through these a little bit more specifically, but what I want to point out is that the ones that are in the green boxes, aripiprazole, pimozide, haloperidol, these are the ones that are approved by the FDA for the treatment of tics and Tourette syndrome. But we actually tend to use them more second line than first line because they do come with some heftier side effects. They do require blood work, and they tend to be less tolerated than some of the other medications. Now, that's not true for everyone, but a lot of people will actually use these tier 1 medications, guanfacine, clonidine, and topiramate being the most common, because even though they have some evidence behind them, they tend to be better tolerated and have good effect, that they're a good starting place. And so I'd like to go through more specifically a couple of the first tier medications and a couple of the second tier medications, and then we can talk about a couple of the other things that were on that chart. And so guanfacine is a medication. You might have also heard it referred to as 10X or Intunev. This is a medication class called alpha-2 agonist. So if you've heard that before, that's what it refers to. And so technically it's a blood pressure medication, but we use it for lots of things, including tics. And so it's also used to treat sleep. It's also used to treat impulsivity, related to or unrelated to ADHD. And then it's also used as a non-stimulant for ADHD. And so depending on your unique needs, this might be a medication that your doctor recommends to help with some of these other aspects, if not just the tics themselves. One thing to consider, especially for younger kids, is that they only come in tablets. So there is an immediate release and an extended release form. The half-lives are actually pretty similar. They're very long acting. So I tend to only prescribe the immediate release because it allows me to break it in half for the pediatric population. And some people tend to report more side effects with the extended release, but every person is different. And so just being mindful that they're both very long-lasting forms of guanfacine. Now, dosing wise, the lowest dose you can be on is 0.5 milligrams, which is usually a half a tablet. And the highest dose they usually go up to is about 4 milligrams. You can go higher, but after that, you're less likely to have additional benefit and you're more likely to have side effects. And so usually if I've titrated someone up to 4 milligrams and we're not really seeing good benefit, I'll talk about trying a different medication or reassessing whether we're treating the right thing. And so common side effects of guanfacine, as I mentioned, it's used to help sleep. And so sleepiness is a common side effect. I tend to dose it at night. So that way, if there's any sleepiness, you sleep it off and are okay by the morning. Everybody, again, is unique. And so for some people, they'll have a lingering morning sleepiness, and I tell them to take it earlier in the evening, usually, and that works well for them. The other common side effects are constipation. It can sometimes cause some tummy upset as well because of the constipation. I said tummy, I'm sorry, I'm a pediatric provider, so you're going to hear those things periodically, but stomach upset. And then because it's a blood pressure medicine, the other thing I tend to counsel patients on are that it can cause symptoms of low blood pressure. Now, again, if you're starting low and going slow, you're less likely to feel these, but important things to be mindful of are like the lightheadedness, dizziness. It can slow down your heart rate, and then the most severe form is passing out, but that rarely occurs. With both this medication and the next medication I'll talk about, because it's a blood pressure medicine, and just in general, our bodies don't like when we stop medications abruptly, but it can cause your blood pressure to spike. And so it is a medicine that if you're not tolerating it, or if it's not working, or you want to come off of it, to talk with your doctor about weaning it down, because having a blood pressure spike can be a medical emergency if it gets high enough. I tend to see that more with clonidine, which is a very similar medication. And so clonidine is in the same class of medications. You might have also heard it as Catapres or Capve. I'm sure there's others out there, but those are the most common two. And it helps with a lot of the same things. So it can help with sleep. It can be a non-stimulant for ADHD. I tend to think of it as more sedating than guanfacine. So for individuals that really have a tough time sleeping, I tend to favor this medication more. But it does come in a variety of ways. So you can have it in a tablet, patch, or liquid. And you can also go up to 0.4 milligrams. And so you might see those all in one dose, or you might see them split. But because it is a medication that makes people sleepy, if you're going to do twice a day dosing, I tend to have a lower dose in the morning and a higher dose at night. So that way you're not sleepy throughout the day, because nobody wants you sleepy and unable to do what you need to do during the day. It has all the same side effects as guanfacine, which again are sleepiness, the low blood pressure, and then the rebound hypertension, so that when you stop the medication, your blood pressure can spike, is more common with clonidine, but it is something we counsel about with both medications. So topiramate is an anti-seizure medication. You may also heard it called Topamax or Trokendi for the extended release version. And it is used obviously for seizures. It's also used for migraines and other specific types of headaches. So if you're having any of those other conditions, this might be a medication that's used. Outside of the neurology world, it can be used for weight loss, and it can be used as, I also believe people will use it for diabetes for weight management. And so you might be on it for different reasons, but it can help with the tics. And so it comes in lots of different forms. It can be compounded into a liquid for people that can't swallow any of the capsules or tablets or sprinkles. And for tic dosing, I usually will go up to 200 milligrams as a total dose, which can be either taken all at once or split twice a day, depending on how you tolerate it. There are higher doses if you're using it for other things, but usually once you've reached 200 milligrams, if you're not really having any, if you're not really having benefit or other reasons, then we talk again about switching it to something else. Common side effects. So topiramate has a lot of weird but rare side effects. I'll just throw that out there, and it gets a bad rap. It's called Dopamax. And so you may have heard that term, but I've had a lot of people that actually tolerate it really well. Again, it's that start low, go slow approach. So as I mentioned, it's used for weight loss. It is, I don't put people on it for weight loss, but it can cause appetite suppression or reduce your appetite, which can cause some weight loss. It's real weight loss. It can also cause numbness and tingling, usually in the fingers and toes. And that often will happen when you first start the medication or when you adjust the dose. And that can be temporary, meaning it'll go away after your body adjusts to the medication. Things that can help with that are drinking like fluids with electrolyte supplements like Gatorade or Powerade or vitamin waters, or eating bananas. And so if you're having those symptoms, those are some of the things that might help make that better while you're having those symptoms. So other people, like I said, it gets a bad rap because it can make people really foggy in their thinking, and they can have trouble finding the words that they want to say. And that goes away when you come off the medication, but it is something to be aware of. And for some people, it can make them tired. Rarely it can cause reduced sweating and also kidney stones. And so if you're somebody that's more prone to kidney stones or has it run in your family, that might be something that we might shy away from using that medication, but also something to talk about with your doctor. And then importantly, for anybody that's on oral contraceptives, it does interact with oral contraceptives and makes them less effective. And so if you're using it as a birth control method, it's really important to use other methods as well, and consider taking folic acid in case there's a chance that you get pregnant. So the other medications, and I just want to be mindful of my time, so I make sure that we have time for questions and answers. These are the medications that are FDA approved, and we'll go through those. Often I will try those first 3 medications I just talked about before we move on to these second tier medications, but that's not the right path for everyone. And so again, that shared decision-making is really important. So Chemazide, or also ORAP, is a really old medication. It's approved for the use of 12 and up for Tourette Syndrome, but it only comes in a tablet. The dosing can be variable, but typically the maximum is up to 10 milligrams a day, often given in twice daily dosing. Although I have seen some people on 3 times a day dosing. I think any medication taken 3 times a day can be really challenging. And so it's just something to be mindful of. A lot of these medications, which are considered in the antipsychotic medications because they affect dopamine, a neurotransmitter or chemical in the brain, they can cause sleepiness. And so that tends to be dose dependent, meaning the higher the dose, the more likely you are to experience that. And they can also cause weight gain, which is real weight gain. So if you come off the medication, the weight doesn't fall off it. It's there. You have to lose it by traditional methods. And for some people, it can cause kind of restlessness and behavioral changes. And so that's important to think about. And with a lot of these medications, it can cause some what we call anticholinergic side effects, which means like there's reduced sweat and dry mouth, but sometimes just using like mints or lozenges can help with the dry mouth aspect if that's the side effect that you're experiencing, but you're also having good benefit from the medication. A lot of these medications, when I mentioned earlier, they have hefty side effects. These are the ones that I'm talking about. They are rare, but they're important to be aware of. And so sometimes they can cause arrhythmias, which are abnormal heart rhythms. Sometimes they can cause seizures, particularly if you stop the medication abruptly or if you're more prone to having seizures. And then if you're on the medication for a long time, sometimes it can cause other types of movement problems. Some that will go away when you come off the medicine, but some that are lifelong. And so that is an important consideration when you're thinking about this medicine. Rarely, these types of medications can also cause what we call oculogyric crises, like when your eyes roll up and they get stuck, and that's easily treatable with Benadryl, but it is something to be aware of. And then because these medications can also impact your blood counts and your prolactin levels, those are some of the reasons that we do blood work periodically when you're on medications like this. And we also check kidney and liver function. And so if you're on this medication, you may be getting periodic blood work, and that's why it's to try to monitor for these side effects before you ever have any issues. Haloperidol is also called Halidol. It's in the same similar class of medications. It can be used for ages 3 and up. It's used in a lot of different capacities, particularly in the psychiatric world, and for treatment of a variety of different things, but it can be used for tic disorders and Tourette syndrome. It only comes in a tablet. And the maximum dose really depends on the age and weight. And so I didn't put that on here, but it is usually given in a twice daily medication form. Similar side effects to what we talked about with Pimozide, the last medication. The only other thing to call out to haloperidol specifically is that it can cause breast tissue development, which is an important consideration, particularly in men or males, boys, because it's real extra tissue that doesn't go away when you come off the medication. And so other similar rare but serious side effects that require some lab monitoring. And I know these sound very scary. I'm just telling you all about them, but we will talk about that. A lot of people tolerate these okay. And as long as you're using shared decision making and you do that start low, go slow approach, you can avoid a lot of these side effects and tolerate them well. But haloperidol itself, if you're on it for a long time for any reason, it can cause cataracts in your eyes. And so sometimes we'll recommend seeing a regular eye doctor when you're on this medication. And then last but not least, aripiprazole or Abilify can be used for 6 and up, comes in a tablet form. Again, the max depends on the age, but is also given in a twice daily form. It does cause a lot of the same side effects. For some kids, it can make them have some headaches. And so that's a little bit different than some of the other medications and something to consider. And then it can also cause like viral symptoms. So being on the medication, you can have like a low-grade fever. It can cause some diarrhea. And so that's something to let your doctor know if you're experiencing those when you first start the medication and when you're adjusting the dose. The other thing to consider, which is true of all 3 of these medications, is that there is a black box warning on all of these for increased suicidality in children. It is, again, rare but serious. And so if there's already an increased risk or you notice any change in mood or these thoughts, it's really important to let your doctor know immediately. A couple of other medications to talk about that some of you may have heard of. So there's a class of medications that are called the VMAT2 inhibitors. These are things like tetrabenazine, also like deutetrabenazine and valbenazine. And they're used in a lot of other movement disorders in the adult realm. And there have been some studies in adults that show that it can have some benefits and tends to have less of those long-term movement problems that some of these other medications have. But there is serious risk. There is a serious risk of suicide and depression with this medication. And so if there's somebody that has depression or suicidality, this is not a medication I recommend. Hold, please. Thank you. The other thing to consider is it's super expensive. And so this is an old paper, and I did check this maybe about 6 months or so ago, but the out-of-pocket costs for these medications are like thousands of dollars. And so it's not really accessible to a lot of people. Some insurances will cover, but a lot of insurances won't. I do think there's opportunities for things like GoodRx and other things that will try to help reduce the cost, but I think that's the main barrier to this medication or those types of medications. And then other considerations, cannabinoids or CBD, there's a lot of interest in these because it's used for a lot of different, it's used in a lot of different disorders. Overall, there's ongoing studies, but the latest is that there's just not enough evidence to either support or go against CBD. And so a lot of people won't recommend it because there are a lot of challenges, and then there are both local and state legal implications to some of these medications to using CBD. And so those are more having those one-on-one conversations with your doctor in the adult population. And it's just also important to know that it's very different. Like the CBD that we use in the medical realm for a variety of disorders is very different than like artisanal CBD, which is what you would get at like your local hemp shop or something like that, which are not regulated. And so just being mindful of that. There's also Botox, which can be used for particular types of tics. And so if there is a very specific, what we call a focal tic, so like a tic that's affecting one particular muscle, and that repetitive use, sometimes doing Botox in that muscle can be really helpful. And so I think about this like when somebody has like a repetitive neck movement or a neck tic, having that consideration, if Botox would be helpful for that particular type of tic, is something that you can talk to your doctor about. But you have to be able to target the specific muscle and relax that muscle for it to have a benefit. Now, lots of people ask me about these, and the short answer is that there's not a lot of evidence behind any of these supplements or using acupuncture or self-hypnosis. There are people that swear by it. There are people that say they help, but there isn't enough evidence in the medical community to be able to recommend these for patients. But I will say, and we'll talk a little bit about research in a minute, studies in these areas are really hard to do, which, influences the fact that there's not a lot of evidence to do these things or to recommend these medications or say that they help or don't help. One thing, I covered some medications. I didn't cover them all just because of time constraints. But one of the things that I think are really important is the common reasons why nothing seems like it's working. And so some of the things I talk to my patients about are we either didn't get to a good enough dose. So this is because we didn't get to a high enough dose. We couldn't tolerate going higher to get to that good dose because of side effects, and that's okay. Or we didn't give it enough time. So if you try a medication for 3 days and something happened, or your tics were worse, or some other factor that caused us to come off the medication, you're not necessarily failing that medication. It's something that you can revisit. We also don't give it long enough time to help. And so, as I mentioned before, tics come and go. And so it's really important when you're trying medication or adjusting medication to give it, ideally 8 to 12 weeks. Sometimes it's hard to wait that long, but trying to give it enough time to really know, is this the natural fluctuation of the tics, or is the medication really helping me have more good days than bad days? Another reason why things don't seem like they're working is because we're not treating the right thing. And so, not every movement is a tic. And so sometimes they may be more of a manifestation of anxiety or OCD or a functional disorder. And the medications that we use to treat Tourette syndrome and persistent tic disorders aren't necessarily going to help in those scenarios. And so that's part of the discussions that you have with your doctors when you're having all your symptoms to figure out what the cause of the symptoms are. Um, and then similarly, if we're focusing on the wrong thing, so even if you have Tourette syndrome or tic disorders, if your anxiety is very crippling and impairing, that addressing that will be more beneficial than treating the tics themselves. And it doesn't mean that the tics don't need to be addressed, but focusing the initial treatment and the adjustments on the most impairing factor is really important. I tell a lot of my patients, if you have, for example, really bad tics and really bad anxiety, if we don't address both, we're not really going to get anywhere. And so we have to try to address both aspects in kind of a stepwise fashion. Other things is not taking the medication consistently. So making sure that you're taking the medications as prescribed. A lot of these medications are not meant to be used on an as needed basis. And so I know that's silly, but sometimes that can be a reason why the medication doesn't seem like it's working. And then the other aspect, which is harder to control, is that you can't get all the care that you need. So this is often within like the behavioral health realm. So there are no therapists in your area or no CBIT providers, or you can't get in to see psychiatry or other specialty care. Or you don't want to do any of those things. And so the other considerations is to all of that, whether there's any financial barriers, travel barriers, a lot of people need to take time off of work and school to do therapy or to go to appointments. And so that can impact you getting the care that you need to try to help move things in a better direction. And then I'll try to go through these quickly, but just to talk a little bit about we talked about making sure that you're treating the thing that's the most impairing. And so a lot of people with Tourette syndrome have ADHD as well. And so there's lots of things that can help, whether it's accommodations within the classroom, and this can be for all school ages. So whether it's elementary school all the way up to college, or whether you need accommodations in the workplace setting, I think those are really important things that can support you. There's different types of therapies that can help work on focus. And then sometimes if the ADHD is the most impairing factor, treating that can actually secondarily help the tics. It can also help minimize unnecessary stressors. So as you can imagine, if you're having trouble focusing, particularly in the school setting, you're constantly getting reprimanded or reminded or given extra attention, that can cause a lot of added stress, which impacts the tics. And so treating that and getting supports in place can actually lower those stressors in the academic setting, and that can also help reduce the tics. There's lots of medications out there, and sometimes treating the ADHD is needed, which is okay. There's stimulants and non-stimulants. There's oodles of medications out there that I'm not going to list, but sometimes those medications that I mentioned earlier on, guanfacine and clonidine, in combination with a stimulant can actually work better together. And just as a quick point, there's a lot of concern about stimulants in ADHD, but there's been a lot of studies out there that show that for most people, and this is, not true for everyone because everybody's unique, but for most people, stimulants are safe to use and treat with individuals with tic disorders when you're trying to help treat the ADHD. And so it might be something that you can talk about revisiting with your doctor. They've done a lot of really rigorous trials that show it's much more likely to be coincidence and timing if the tics get worse in starting a stimulant than a cause of the stimulant itself. OCD in general, also there's specific types of therapies that can help for that. OCD and Tourette syndrome tends to be a little bit different than the OCD that we think about in other ways, like that I have to clean my hands so many times or touch a doorknob so many times. It's this need to be just right or really particular, or I have a certain routine that needs to go a certain way, otherwise I can't move forward. And so if that is the most impairing factor in your day-to-day life, there's specific types of therapies. And then sometimes if it's for more severe OCD, therapy in combination with medication. They use a lot of the same medications that you use for depression and anxiety, just at different doses to try to target the OCD symptoms. And so you may need to work together with your neurologist and your psychiatrist. And I'm not sure if these slides will be available after, but I just want to make sure to be mindful of time. So there are some side effects with these types of medications, and usually trying to go slow minimizes the risk of any of the additional side effects that you might have from some of these medications. And anxiety, as I mentioned, is also very common. There are therapy, there are medicine. The one point that I wanted to make, particularly in younger kids, is anxiety might look a little bit different. And so in adults, you know, we can say, I feel anxious, I'm worried, but in younger kids, the way I like to think about it as kids will either present as turtles or tigers. And this can be true of some adults too. So for anxious kids, the turtles shut down. When they get really worried or stressed out, they kind of clam up and they go in their shell. Or you have tigers who lash out. And so sometimes behavioral issues in younger children can be a manifestation of anxiety. And then depression, so mood disorders and depression are unfortunately common in Tourette syndrome and tic disorders. And so the treatments are very similar, which can be therapy, medicine, or a combination of both. And then just as I mentioned, you know, when you've tried lots of medicines, you're making sure you're treating the right thing and the tics are still impairing. There are a lot of things that are out there that are being studied and have some evidence behind it, but they may not be readily available. And there's a lot of mixed evidence behind these things. And so it's really having good decision making with your specific provider as to whether these are things that are, one, available, but also two, appropriate for you. I would say that deep brain stimulation in the adult population is probably the most talked about, and there's very rigorous or detailed criteria as to whether somebody qualifies for an evaluation for deep brain stimulation or not for Tourette syndrome, but it's also the evidence is mixed. And so it's, again, really important to have those discussions. And then there's less invasive things like magnetic stimulation and nerve stimulation, which, again, the evidence is mixed, and so may or may not be available or something that your doctor recommends. A couple of you asked about research, and so I just wanted to make, you know, kind of what's on the horizon. I just wanted to make just the point that research is really important, but it's hard to do, particularly in Tourette syndrome. And some of that might be because, well, some of it is because, you know, the tics, I already mentioned, they fluctuate, right? And so when they come and go, it makes it really hard to know whether the treatment is having an effect or not that you're trying to study. And there are many things that impact the tics that you can't control for in studies. And so that makes it really hard for studies to do. Another challenge in Tourette syndrome is that we don't really fully understand what causes it. So it makes it really hard to develop specific targets or treatments or even biomarkers or tests to be able to monitor and try to intervene. But as many of you know, it's not just the tics. And so a lot of these studies really try to either exclude people with other condition, which makes it hard to say how it's going to help in the real world because most people have other co-occurring conditions, or it makes it hard because sometimes the medicines that we're trying to study also impact these other conditions. And so is it helping the tics? Is it helping the other condition? That's hard to say in research. And then numbers. It's hard to get people to enroll in studies, and there are many studies, and I'll give you the website where all the ongoing studies are. Many studies are stopped because there's a lack of interest, or it's hard to get people to stay in studies, whether it's just lost to follow-up or they're experiencing side effects and they want to come off these medications. And then, like I already mentioned, because we're trying to see if these things have impact on the tics specifically, if you take out people who have other conditions or who are already on treatment for tics, it makes those numbers even smaller. And so it makes it harder to say this is how it's going to impact the larger population or in the real world setting. And then in pediatric studies in particular, there's a lot of extra regulations because they're minors and they're a protected population. But without research and clinical trials, we wouldn't have a lot of the treatments that we have today. And they're definitely not perfect, but there are treatments that are available. There's also a lot of ongoing studies. And so clinicaltrials.gov has the most up-to-date list of ongoing studies. These were just a couple that I pulled from, and I don't endorse any one of these specifically. These were just a couple that I wanted to list just to show you that there are both medication and behavioral treatments that are currently being studied in Tourette syndrome. And then last but not least, and I think probably one of the most frustrating things in your day-to-day life is that, it's not just the tics. And so as you're working with your team to try to talk about whether behavioral therapy or medicine will be helpful, you're really trying to balance all these different things, which can be really frustrating. And it can also be a marathon instead of a sprint. And so I just wanted to acknowledge that fact that it is really challenging, but hopefully with the right discussions and shared decision makings with your team, you can find what is the most beneficial for you. And I believe that is it. I'm going to stop sharing.
Thank you so much, Dr. Martindale. We
Yeah.
truly appreciate your expertise and your insight to topics here discussed here at TAEA, and we appreciate you for being here this evening. So folks, we are going to go ahead and get into our Q&A segment. But before I do that, I would like to bring your attention to our chat. And in that chat, I went ahead and placed the link for our survey. We will really, really love to hear from you. So please take a moment to share your feedback on this webinar with us using that survey link. And with that being said, I will go ahead and get started on the questions. We do have quite a number of questions. So I know that we are almost at time, but we do ask for your patience while we go through this. And just a disclaimer, if we so happen to not get to your questions in time, we will definitely partner with Dr. Martindale to get those questions answered and back to you in a timely manner. For those of you who are asking for recordings, this webinar will be available on our YouTube page in about a week. So you will be able to refer back to it for all of your questions or reference or what have you. All right, so without further ado, our first question: why do doctors want to diagnose functional neurological disorder when TS worsens as a person ages?
Let me make sure I understand the question correctly. So functional neurological disorder is a really broad topic and could be an entire separate lecture. But the important in distinguishing between Tourette syndrome and functional neurological disorder is that we don't want to do unnecessary tests. We don't want to put people on unnecessary medications in either way. And so making sure you're treating the right thing is very important. Behavioral therapy often helps in both situations, but the medications can be different. And so it's really important to make sure that you have the right diagnosis. And for a lot of people, they may have both, but that you're treating the right thing and approaching it the right way with your doctor.
Thank you so much, Dr. Martindale. All right, next question. My daughter is on ORAP. It's spelled ORAP. I'm not sure if that's an acronym, but my daughter is on ORAP for 2 years. She is now 14 and is asking if she can ever stop taking medication. The question is whether things get better and she can stop taking it.
Yeah, so just as a general disclaimer, I can't give any specific medical advice to people, but when you start, we talked a lot about when you start medication. We didn't talk as much about when you can stop medication. And so every follow-up visit, you should be having a conversation with your team or your doctor or your clinician, how you feel like your tics are and whether you still feel like you need to be on the medication. Because tics come and go and change, and for some people they outgrow it, it is appropriate to consider coming off the medications if your tics have been in a good place for several months. But again, it's that shared decision making and deciding whether that's the right time for you. But it is, I would say that most of us don't want you on medications that you don't need to be on or longer than you need to be on them. And so it's okay to have those discussions.
Thank you so much.
Mhm.
Next question. I have heard about people having success minimizing tics with full spectrum CBD oil, and I wonder if you have any stats on the success of that or any specific brands or kinds that are best.
Yeah, so unfortunately, I don't have any specific stats or research on that. Like I said, CBD is something that's being studied, but there's not a ton of evidence. And so legally, I can't recommend any specific brands or other things like that, but it would be more of a state regulation and talking with your specific doctor as to what your rules and regulations are and what's available in your area and whether that's the right choice for you.
Thank you so much. Next question. On the long run for ORAP, does it have any side effects in affecting pregnancies and the fetus?
Yeah, so that's a good question. So a lot of these medications, like I said, they do tend to have heftier side effects. And so if you are considering getting pregnant or may get pregnant, it's important to make sure that you're probably on an oral contraceptive or using other birth control methods. I don't know the specific effects that have on the fetus, but a lot of these medications can have some risk of affecting the fetus. I just don't have the list of specific types of effects.
Perfect. Thank you so much.
Mhm.
Next question. Can you please go over Prozac?
Yeah, so generally, I mean, Prozac is, so fluoxetine or Prozac is used for a lot of different things. It's often used for anxiety, depression, or obsessive compulsive disorder. And so, as I mentioned with those, it's a start low, go slow approach. And it can take several weeks before you start to see a benefit. If you're using it for OCD in particular, you often have to get to higher doses to have that benefit. You might see the benefit from an anxiety perspective earlier. But the actual range of dosing depends on what you're using it for, your age and your weight. But it is a very common medication that is used in a lot of these conditions.
Perfect. Thank you so much. Next question. What are your thoughts on Botox for motor tics, specifically eye and jaw tics?
Yeah, so I talked about Botox as a possibility for motor tics. You specifically have to be able to target the muscle. And so if it's a variety of movements and sounds, Botox might not be as helpful than if you're trying to target a specific muscle or a specific repetitive movement or motor tic. A jaw tic in particular, for example, it would really depend on what the jaw tic looked like and whether targeting a single muscle or both muscles would help. I think I also saw something about Botox for children. And so most of these things are not approved in pediatrics and would only be recommended for adult patients. But for some older teens, these are things that we can consider. And again, it really depends on the type of tics that you have, whether that would be helpful or not.
Thank you so much. This is a two-part question. Do you have any knowledge of whether these medications are similar to what is available in the UK? And the second part of the question, are there any cases / medications where someone's tics could worsen?
Yeah, so I'm obviously from the United States, and so I do think that there are a lot of similar medications available in both places. There are probably some regional preferences. So there are European guidelines out there for the treatment of Tourette syndrome that recommend a little bit different, what's the word that I'm looking for? A little bit different algorithm or how you approach the tics in terms of medications, just because of what's available, more readily available in other countries. And so they may recommend a different antipsychotic agent than Abilify or haloperidol because of what's more easily available in the UK. And so that's a harder question to answer because it might also be local. And so, but a lot of these medications are covered in both sets of guidelines. And so there should be some crossover as to what's available and relevance of what I talked about, even outside of the United States. The second question was about worsening of tics. So yeah, I mean, everybody's different and tics come and go. And so that's the problem, right? And so when I and starting a medication, what I tell people is the tics are still going to come and go. But what I want to know is, over the next 8 to 12 weeks, are you having more good days? Are you having more bad days? Because then I can really decide, is the path of the tics getting better? Is it getting worse? But you're the one that's living with the tics every day. And so if it's something that you're not able to tolerate, or it's something that's really impairing, you have those discussions with your doctor. And I think the other thing is to consider is what other things might be going on that can increase the tics, right? So tics are impacted by a lot of different things. And so medicine might be something that you're introducing that's new, but did that impact your worries? Is there something else that's going on? Is it impacting your sleep? Because that can impact your tics. And so thinking about all those different factors, I think, are really important.
Gotcha. Thank you so much. This next question is a combination of some questions that you've already answered, one being the Botox recommendation for children, which you just answered in the previous question. And this person also asked, have you ever seen patients tics worsen when taking clonidine specifically?
Clonidine. Yeah. So it's, I think, the same answer to what I just said. Everybody's different, right? And so the main clonidine is something that I prescribe all the time, but everybody's unique. So the main thing that I would consider is that when we're tired, our tics can be more noticeable. And so if the medication's making you more sleepy, you might have an impact from that. That are influencing the tics. And so I will often try to make sure that we're not overly too sleepy, particularly during the day. And if there's any sleepiness, that's where you get the dosing at night. But again, there's a lot of other factors that influence tics. And so it's just important to think about all those things.
Perfect. My next question is, my teen and many others I have met are extremely sensitive to medication in general. Do you know if this has been studied in TS patients? And if so, why does this phenomenon occur?
Yeah, that's a good question. I think anecdotally, I do see that some people are sensitive to medication. I do think that other co-occurring conditions play a role in that, but no, it hasn't specifically been studied as to like why it happens or to better kind of characterize that.
Thank you. How do doctors diagnose Tourette? Is it only by asking questions, or is there a test, blood test, that can be done for diagnosis purposes?
Yeah, so it's just based off a clinical diagnosis, which means it's having that discussion with your doctor about what the movements and sounds are, why you have them, what happens if you don't do them. So there's no specific tests, blood work, imaging, or other things that can specifically say you have or don't have Tourette syndrome. It's just a it's a clinical diagnosis.
Next question. Is it likely to find a medication that doesn't cause sedation, or is it simply an expected and inevitable side effect for most of these medications?
Yeah, so a lot of these medications can cause sleepiness, but it tends to be dose dependent, meaning the higher the dose, the more likely you are to experience that. I would presume nobody wants their patients to feel sleepy and to be groggy during the day. And so it isn't something that you should just accept as an inevitable side effect. But playing around with the total dosing, the timing of the dosing can help minimize those side effects. But the goal of treating tics is to make them less bothersome and less interfering without you experiencing side effects. And so I would say that goes back to just making sure that you're treating the right thing on the right medicine, on the right dose. We want the tics to be better, but we also want you to be able to function and feel normal.
Understood. Is there a typical step therapy that is generally recommended? For example, are there tier 1 medications that are generally suggested in a certain order?
So I'm not sure if you caught the beginning of the talk, but the general approach, like I said, for a lot of people is using off-label medications that are better tolerated, but have maybe some medium evidence behind it, before using what we consider tier 2 medications, which are the FDA approved medications, because they tend to have heftier side effects. And so, guanfacine, clonidine, and topiramate were the tier 1 medications. There's no specific order. A lot of it is provider preference and what else is going on that you may or may not benefit from one of those medications for.
Thank you so much. To Suzanne's 14-year-old daughter, I'm sorry, this wasn't a question. I believe it was a comment in response to a question. My apologies. Next question. Do hormones and menstrual cycles affect medication for teenagers?
Generally, no. Although I will say that hormones, puberty, adolescence are a really challenging time. And so there's a lot of physical and emotional stressors that come with it, that can impact your tics from those physical and emotional stressors. And so I don't think that the medications impact the hormones, but hormones, like just that time of your life, can be really challenging and can impact your overall severity and intensity of the tics that you're having.
Thank you so much. Next question. How do you know if you've built up a tolerance to a medication you've been taking for a long time?
So a lot of these medications are not ones that you typically build a tolerance to or become dependent on. Some medications are, so it kind of depends on what you're on. But if you've noticed that you've been on a medicine for a while and it's no longer having the same benefit, then it's time to have that discussion with your doctor as to whether, again, there's other things that might be contributing or whether it's time to consider a different medication.
Yeah. Thank you so much. Any new information on tic relief for a lifelong person who showed tics as young as 3 years old and is now 27 years old and continues with tics? Something a child would not be good for.
I'm not exactly sure what that question is asking. I mean, tic relief can come in a variety of ways, right? It can be therapy, it can be medicine, it can be addressing the co-occurring conditions. So I think it depends on what is bothersome. And then as being an adult, there are some other things that are available that aren't necessarily available to kids, like I mentioned, Botox and things like that for specific types of tics or certain types of medications.
Thank you so much. The next question is a comment and question combined. It says, I see a lot of folks on Facebook groups using magnesium, B12, etc. to reduce tics. Have you prescribed this, or could you speak on the validity of this treatment?
So for tics in general, no, I have not prescribed it. But as I mentioned, like a lot of the other supplements, these are, there's not a ton of evidence behind these because these studies are hard to do. And so usually what I tell people is that a healthy lifestyle is the most important. So when your physical cup isn't filled up, so we're not eating well, we're not sleeping well, it makes us less capable to deal with our emotional cup. And so, like I said, eating well, sleeping well, exercising, physical activity, and a multivitamin a day, like those are the typical healthy habits that I recommend to fill up your physical cup.
All right, thank you so much, Dr. Martindale. For those of you who did not get your questions answered live on this webinar, we will connect with Dr. Martindale to get these questions answered and to you as soon as possible. Again, we thank you so much for being here and for sharing your expertise on such a well-needed topic. And so we appreciate you once again, and we appreciate you all for attending, and we hope that you have a good evening. Please don't forget to fill out our survey. We would love to hear from you.
Thank you.
No problem.